Hello, friends. This is Thursday, and it's Medical Billers Network Live Day. No, it's not really. We're doing Inlera. We're going to do Inlera U Live because today we're talking medical office reception. And so my friends who have been hanging out with us for this whole series know that it is a part of the revenue cycle, though not directly, typically a medical biller's responsibility. So this is Inlera University. If you're brand new here, say hello. Let me know that you are here. My name is Jasmine. I'm very pleased to meet you. I am the proud mama of this space here on the tube. This is a place where we are committed to alleviating the stress and confusion in the business of healthcare. And we do that by educating you and supporting you with tools and resources. And yeah, we have channel members here in this space. If you are a channel member, special shout out to you. Thanks for hanging out. And today we are diving into a software looking at the responsibilities of medical office reception. But before we do that, I want to know what questions you have about the function of the front office or how it might relate to the revenue cycle, really anything in between. If you ask a question that's not exactly on topic, we will maybe answer it or file it away. Yeah, oh, Nicole's here in the chat. So if you have questions, Nicole is hanging out in the chat in the green room, we'll call it. And so feel free to say hello to Nicole as well. And when you guys get in the space, we are going to be chalking. We're going to be chalking. That's talking and chatting. We're going to be talking about, I almost did it again, the function of a medical office receptionist for primarily medical office. However, my folks who are in the hospital setting, there's an overlap sometimes in patient registration and that function. Oftentimes in hospital setting, because there's a lot more to do, we end up with a kind of a wider range of responsibilities in a medical office versus what we see in a hospital system or a larger group setting, because there are more people required, because there are more people. So yes, and Nicole is asking the question of the day. Just as a reminder, what questions do you have for our Q&A? So we have been talking these last 3 weeks. This is our fourth touch on this topic related to this area of medical office reception, because we really want to make sure that our folks who are interested in breaking into healthcare feel supported. And also we want you all who are in the revenue cycle side, understand the role of a medical office receptionist and potentially what it means to be an effective one, because it is where all the problems could end or begin. And so we could stop a potential issue from causing claims issues on the back end. So medical office reception is one of the most vital functions, because it is where all of the data that we need as medical billers and coders, even that data that we need to be able to do our jobs effectively, starts with this role. So really hope that you guys understand that. Oh no, I'm getting a little pop-up. Hopefully I'm not super messed up. Oh, Nicole's giving me the nod. I messed up. I messed up, not me, it's the internet. One day I'm going to get this fixed. I've been trying to do lives from another location so we don't end up with this issue. But let's see if it cleans itself up. We'll give it another minute or two. Sorry, guys. Did you see Todd's comment there, Nicole? Oh no, I'm totally frozen, huh? All right, my bar is not going above 1. Can you still hear me though? No? Yes, you can. Oh, okay. All right, so the internet gods are disliking. Yeah, I'm going to continue on just so we stay on time and on topic. And hopefully you guys can hear me fine. And if that sounds weird and robotic, Nicole will let me know and we can go in a different direction. I've got 1 bar still though. I don't understand that. I gotta go from everything being perfect while we were preparing to 1 bar. All right, well, let's do this. Let's go ahead and get started. If you guys have issues hearing, we will decide what to do from there with a pivot. Oh, I get 2 bars now. Hopefully we'll get the 3rd one. Let's see. Okay, I am going to get us started. So here's the deal is I first want to talk about what exactly a medical office receptionist is responsible for, and keeping in mind that it's going to vary depending on the organization, the size, and just overall infrastructure, because there are some places that have zero infrastructure, and they are kind of leaning on the medical office receptionist to do a variety of other tasks that aren't directly under the function of an office receptionist. Okay, so just keeping that in the back of your mind is that if you have had an experience where you are also part-time cleaner for the office and also the person who sterilizes all of the equipment, you're kind of overlapping in some other functions, some other roles, and some practices don't do eligibility and benefits on the front office reception. So there's kind of a mixed bag of responsibilities, which is always possible. So with that said, I'm going to go over what are typical responsibilities, and then we're going to move into a software. We're going to look at open practice management today. In open, we're going to look at functions that really are typical of a medical office receptionist responsibilities. So let's look at this list here, and I'm going to make little comments around certain things that I want you to be aware of, just in case you're someone who's coming into this field and don't really know or understand. Oh, we're back. Yay. Okay, cool. Saw your message. All right. So first things first is that as a medical office receptionist, there are just general reception responsibilities that are going to fall under this role, and things that you would think of like the greeter and the meter and the voice and the face of the practice, right? That's typical. So you are the person who's welcoming people in, checking them in, routing patients and visitors. So if a vendor is there, if you have a pharmaceutical sales rep that's coming into the office, you're also the gatekeeper. You're the person who kind of stops that individual from interrupting the day, from just disrupting the medical office flow, and the one who takes the messages to prevent things from being interrupted. Yep, I'm getting another grumble. Okay. Hopefully you guys can still hear me. So when we talk about that, the gatekeeper role can happen in person, right? Like I just mentioned, people that are coming in, a patient who walks in the door and says, hey, I want to talk to the doctor. Like, I don't think so. I can take a message for you, or, let me pass it over to the nurse, because that's really the nurse's responsibility versus the doctor's, right? So things that might be you being able to apply and discern whether it's okay. You love my hat? That's funny. It's great, right? So my awesome hat, shout out to, if anybody ever comes to Charlotte, there's a local deli called Rhino, and this is actually their hat. It's from a deli. It's like kind of a deli hangout place. It's like a hybrid thing. They also have like a little convenience shop. But it's a very popular place, and they always have activities, live music and things like that. But yeah, this is from Rhino. Cute, right? So thanks, John. All right, so back to our usual programming. When it comes to being the gatekeeper, right, the responsibilities of gatekeeper also translate to phones, because you have to be able to identify whether or not it's okay for a particular individual to get through to whomever, whether it's the nurse or even someone like the medical biller, right? It's like, is this caller a salesperson, and is it going to disrupt what's taking place or should be taking place in the practice today? And is it urgent, truly? Do I need to get the call to that individual, or is it something that I should be taking a message for? So those are all skills and we'll say kind of parameters that you will learn as you begin to work with certain practices and organizations, because it is going to depend. There's not like a one set rule, right? If it's always a pharmaceutical rep, some doctors love talking to pharmaceutical reps and they get free stuff and they have great conversations. And so it's going to depend upon the individual practice and what their parameters are for letting people in or deciding to take a message. So you'll want to get that clarified as you are onboarding and starting to operate in your function. All right. So next thing is assisting patients with paperwork. So this happens a lot, especially if you're in an internist office where, you have folks who have challenged with, if you're giving them an iPad or some other kind of device to enter in their paperwork, to enter in their intake information, the new patient forms, there is a chance that you're going to need to assist them, not just to make sure that it's complete, but also do they just need help navigating with that device, or even with pen and paper. There are some patients that are challenged, if let's say you're in an ophthalmology office and someone just had a, very invasive eye surgery, right? There's a chance that they may not be able to come to your practice and complete paperwork that you might be giving them. So it's important to just discern whether someone needs your support, and you would be that person, whether it's you or someone else at the front with you, to support those patients. Comforting distressed patients. Now, keeping in mind, right, we're talking about a wide range of specialties here. So there are patients that might have just come from an oncology appointment, and they're coming to your specialist office to continue with some very difficult medical conditions that they're combating, right? So these patients are also a little bit maybe challenged with what they're facing emotionally, just the journey of navigating whatever it is. It could even be, grief of having lost someone or on the verge of losing someone, right? So being aware that you're using your human skills, right, people skills, to be able to support folks both with absolute things that need to get done, like paperwork we're talking about, but also just being more sensitive to what their needs are in the moment, right? And allowing them to feel your support. So for example, if someone is coming in and you're clearly visibly upset and you have no tissue boxes left in the waiting area, right? You might bring a tissue box out. You might make them aware of, that you have tea, and maybe that could help them calm down or feel less, wound up, right? So those are all things that you would also be likely responsible for as well. So switching back to kind of more tactile or tactical, we'll say responsibilities, things that are more specific to kind of patient flow, is stuff like making appointments, and that's making appointments by phone and also in person, right? So you're the one who's probably scheduling the patient's next appointments, or you're the one who's rescheduling an appointment if they were late and need to be, moved on the calendar. And you also might be the one responsible for the provider's calendar as well. So scheduling their meetings, maybe it's a meeting with their accountant, or, a meeting with another vendor that they're looking at bringing into the practice. Those are often responsibilities of the receptionist as well. And maintaining the provider's schedule, meaning ensuring that they don't have overlap, is a primary function of the medical office receptionist. And sometimes, depending on the size, you might be responsible for one provider and, your counterpart responsible for the other provider's schedule, right? So just being aware that you are supporting the providers and making sure that they are not overlapping and running themselves too thin in that little window of time that they are committing to being with patients or the vendors. All right. So next is making sure that the patient's accounts have up-to-date information, because when we talk about interfacing with our patients, you often might get information that is vital, right? You might be getting some things that are updates about our patients that we need to be aware of, right? Patients that are like casually saying, oh, I'm going to be on vacation for the next 3 weeks or what have you, and it's a therapy practice, right? If you've got a provider that starts worrying about, where's the patient, and, like a psychiatric practice or something, they haven't had contact with the patient, and they didn't mention in their appointments that they are going on travel, but they mentioned it to the receptionist, you could put some information in there to support the fact that your patients are going to be gone for, a number of weeks out of country or whatever. So we don't have this miscommunication or disconnect from the front to the back. That could be helpful. And then there's other things like if a patient just changed insurance, right? Those are things that we care about in the revenue cycle. Like patient brought in new insurance and I scanned it in, or I wasn't able to get in touch with the company, but here's the card, right? So just making sure the information is clear about when these types of things are shifting and adjusting. All right. Next, we talk about reconciling payments and taking in payments. Most of our medical office receptionists are the ones that are interfacing with any collections from both patients and also correspondence that comes in the mail, meaning if an insurance company is paying by check or what are those virtual credit cards, meaning they have sent over a printout that happens sometimes, whether mail or fax, and that front office receptionist is often the one who has to run those cards, who has to process those cards. And any payment that comes in, they are the ones responsible for putting that into the software. So when that happens, you're taking the payments in, you are also the one who has to reconcile and ensure that your patients' payments are accounted for in their software, in the practice's software. Okay. So cash management or money management is also a function that falls on the medical office receptionist. Basic maintenance, right? Keeping the area clean, organized, making sure that it looks welcoming, right? Both the reception area and the front desk, because patients walk up and they will see that mess that you have there. And so it's helpful to have a cadence and a process by which you are cleaning up your area and making it an area that is able to function well for you, but also anybody else who might come in and support you as an office receptionist. So next is inter-office communication. So you might be communicating with other provider offices. If you're referring patients out, you're definitely communicating with insurances. There are also instances where you're communicating with labs and pharmacies and things like that. So it's really important to know that you're kind of this middle person potentially. If there's not a lot of nurse support, those types of things might fall on you and your responsibility. I'm realizing the underneath scheduling appointments, it doesn't have this, but this is something that's on the list, is reminders for those appointments and making sure patients are not forgetting. Nicole, can you make a note? Because I got to update that actually, because this came directly from my presentation. Yeah. So reminders for patients' appointments and making sure that they are confirming appointments is often a responsibility of a medical office receptionist as well. And then I mentioned earlier, equipment sterilization and maintenance is sometimes a responsibility. Now, depending upon what area of the practice, what specialty you're in and what area of the practice kind of you're responsible for, you might be required to support the nursing staff, right? To be able to help keep the areas clean that are in the back. Maybe just kind of the middle area, we'll call it like triaging areas where you've got patients that are coming in, maybe interfacing with things like the blood pressure cuffs and scales and things like that before they go into the medical office, right? Some of the receptionists sometimes have that kind of middle section responsibility as well, okay? Basic things that you're responsible for sure, are making sure that you are adhering to all of the privacy policies, making sure that you understand what the procedures are as it relates to your ownership of those responsibilities as well. So I'm realizing, Nicole, I don't have music. I just realized that. Do I not have music? Can you hear music? Oh, it's just very low. I had my volume down. There we go. I've got music now. Somehow it changes my energy when I don't hear music. Okay, now we're on. Okay. Last thing that I have there is communicating the medical results for patients' care. There is a chance that in practices, depending on the size, they might use you to deliver certain types of results, perhaps negative results or ones that they will easily say, okay, have the receptionist do this during their downtime. And downtime in healthcare is typically what we call the time in which there are no appointments on the books for patients to come in, but we are still in the office and responsible for doing other work. And so some of that other work that would come into play would be things like that I did not put on this list for a reason, because it's not necessarily a requirement. It are things like eligibility batch checking that sometimes overlaps into other folks in the practice, and processing authorizations and referrals. It does fall onto receptionists in a lot of practices, these two things. So the eligibility benefits and your referrals and authorizations. However, there are a lot more practices that have a little bit more ownership in a different role in the practice than a medical office receptionist. And someone who's new to medical office reception may not have those kinds of responsibilities right out of the gate for a lot of reasons, right? Because again, the quality of the data, right? So I didn't put things like, the routing of patients and assisting with paperwork, things like that. Basic, when a patient comes in, just checking them in, it's giving the patient, the paperwork, taking their cards, doing those are all kind of assumed parts of the role of a receptionist. But Again, dependent upon the practice and the practice flow, you may or may not be responsible for checking out. You may or may not be responsible for calculating the patient's deductibles and co-insurances or other responsibilities when they leave the office, right? Because that might be another checkout role. So again, these are typical. These are ones that are going to cover most of the bases. But when it comes to routing our patients, usually a receptionist is going to be responsible for that welcoming and the first steps of bringing them in. And potentially when the patient is leaving, right, getting the appointments on the books, providing their prescriptions and all of those things. So what questions, what did I miss based on your experience? I'm curious if you have had other functions or responsibilities that in a medical office that are not on this list and you want to know, or you want people to know, let me know, because I really do want to make sure that we are giving everybody a list of responsibilities to just be aware of. So, and while you guys information, I am going to turn off this guy and just say a couple of quick things. So that starting list, right? That list of roles and responsibilities for this particular role is one that can change depending on the area. When we talk about a hospital system, right, I mentioned already, sometimes they have a bit more narrow scope. That list, and it might whittle down to assisting patients with paperwork, making sure their paperwork is complete, scanning documents, right? Like you might have a more narrow scope of responsibilities because the other team members that are processing authorizations or routing our patients, and we end up with a much larger number of support staff. Okay. So with that said, when we are in a medical office, no matter what, we are using software. And so today I want to give you a little bit more of an inside view of what we just looked at, which is, Nicole says no notes. I like it. That's Nicole's the no notes related to receptionist because she's been a receptionist. I'm going to get into the software and we're going to look at some of those responsibilities as it relates to the software. And again, just a little, this is a demo software. I'm not going to go into all the details, but I do want you to understand that like most of the medical office receptionists are starting in a particular area and they kind of stay in said area when they're in a software. Okay. So with that said, I am bringing to the stage, as it calls it. Is it blurry? Can I zoom it in more? I just realized I forgot to double check the sizing with you. Is that better? Whoa. Is that better? It looks fine on my side, but I can't really tell. Yeah. Okay, cool. Getting thumbs up. All right. So, okay. So when we are a receptionist, the core responsibility is the routing and arrival of our patients. So that typically starts with scheduling, right? We want to make sure that our patients actually make it to the office. So in this software, again, this is Open Practice Management. If you're interested and want to know more about the system, we always have the links about the software in our description box. But medical office software, it varies from system to system, right? What the medical office receptionist role will look like will vary. For the most part, they are starting with a calendar or with a schedule in some way, right? So when I look at this one, I'm looking at a scheduling dashboard that gives me a few different functions. But if I'm in another practice, I might like right away be responsible for engaging directly with the calendar. And so we're going to talk about this dashboard because I like that it gives a nice little overview, but just know that it's going to vary. Every software is different. So whether it's a practice management system or a full EHR, which is our electronic health records, a practice management system sometimes doesn't have a lot of visibility to the billing components from a receptionist. So, and in a lot of systems these days, there's an increasing number of what we call role-based functions, which means that if I'm medical office reception, I may only see these in certain software, right? If it's set up correctly, they've limited my view to only the things that I am responsible for or that I should really be privy to, okay? And that's for the sake of also privacy and protections. It's what we call the minimum necessary rule, which means that you are only touching and engaging with the things that at the absolute minimum you need, and we don't necessarily need to give you more than what you would what you would ever really need to do, need to use to be able to do the work that's asked of you. Okay. So as a receptionist, I could very well never see a patient's ledger or balance if I'm not the one responsible for that collections. Maybe I have a checkout person who does that. Maybe I only see my patient's copay or coinsurance on the on that check-in screen, and the checkout screen shows patient balances and things like that, right? So just keeping your mind wrapped around the different software dependent upon the environment and what you can see might change. So what I show you today is not, it's not something that you should anticipate or expect from all software and any practice, but it is something that I would say is more common that you're going to see the majority of the functions that we're looking at today. Okay. So with that said, calendar is oftentimes where our office receptionist will start, right? So in any practice, you might have a variety of different views for your calendar. So if I'm looking at one doctor in this particular instance, there's like 2 different providers, right? Or 2 different locations. I could actually, there's a lot more in here. So there's multiple resources, as they call it, which are like areas of the practice. And then looks like 5 different locations, right? So based on the view that I'm responsible for, let's say I'm only in one location, I might only want to ever display that particular practice, right? And what that will help me with is just to ease my view and be able to very easily see, more clearly see what I'm responsible for as an office receptionist. So what I care about is obviously what's on the docket for the day today and potentially tomorrow, right? If I'm the one responsible for eligibility checking, I care about what shows up on my calendar tomorrow, because I want to look and see whether or not my patients have been eligibility has been run. So I just clicked into any cell, just so you know, where it's telling me if I clicked into that cell, it's picking that time and day, and it's letting me add an appointment, right? So as I mentioned, there's different resources. I might be adding it in specific areas or with certain nurses. Also get the option to pick my facility here, right? I also can block out time. Remember, I just explained to you that you might be the one responsible for a provider's schedule. So if the provider is, let's say, going on vacation for 2 weeks or something, I might be the one that needs to block the appointment, the calendar, so that no appointments can be scheduled. Okay. So if I'm looking at adding these appointment details in, I'm going to put in the criteria that's necessary. Then I'm going to choose, like, am I adding my patient in based on searching? Am I getting that type of appointment based on whatever those appointment criteria are according to my practice? Again, this is, dependent upon the practice, how they choose to list their appointment type. There is a chance that they might do it based off of, like here you see, based off of symptom as well. And so there are different variations of the ways that practices like to list their patients on their schedule. And of course, that would sometimes be dependent upon the specialty. That could help clarify the reason for that patient's appointment in that moment, and also block specific times for said appointment. So this I hope clarifies. I'm not going to go super detailed about the appointment types, but you get the general idea. We're going to schedule the appointment. We're going to pick whatever appointment length is appropriate, and it even lets me attach procedures. I don't necessarily think most medical offices are going to ask you as a receptionist to select the procedures that we believe are going to be performed, unless, of course, you're in a specialty where, let's say you're in an invasive maternity ward, like you're doing a specific kind of exam that always has pre-certification required, and you are know that this procedure has been pre-certified because you authorized it yourself. I'm using authorized and pre-certified kind of as interchangeably, but basically getting authorization for a specific service that has a procedure code attached to it, a CPT code, right? Current procedural terminology. We know that this procedure code has been authorized by an insurance company. We need to make sure that the appointment is for that procedure code. And so sometimes you might want to attach based on that criteria, because we don't want this appointment to be billed under something that is not authorized, right? So that is an instance that you might attach. We just mentioned as well some authorizations as well. So maybe picking authorization, choosing a referring provider, because if you're in a specialty and you require referral or an authorization for your services to be on file, you're going to make sure that you have the doctor's name that referred the patient to you, and then of course just a reason for the referral, just for your records as well. All right. So so if we have all of this information in file, majority of our patients, that would kind of cure the setup for our patients that are being scheduled. You don't need things like hair color. I don't even know why that's up there, but maybe just like as an FYI, I don't know. But you could schedule recurring. Again, we talk about therapy offices. If we find out that a patient is like has a care plan or like has been received a treatment plan from their mental health professional, and they've decided once a week for the next 12 weeks or whatever, they're coming in same time, same day, you can make the appointment recurring, which is nice. All right. So that is adding my appointment from a quick perspective, right? Just trying to get my patient on that schedule and keep it moving. So yeah, I'm going to go back to the scheduling dashboard and we'll talk about a couple other things on here. So when we talk about our patient registration process, it's going to vary. Again, if you are using an intake software that is processing an electronic version of your patient's the forms and intake, the initial registration documents are coming into your software electronically, then you may not have to do any manual data entry. But what you would do as a receptionist is review that data for completeness, right? Which is in most cases what needs to happen. So you're going to be the one responsible for reviewing the data, making sure that it's present, making sure that it's complete. Oh, I love it. Oh, I see. Yeah. Oh, yes. Great point. I'm just looking at Blue Butterfly's comment here. It's a plus if you speak another language. Yeah, absolutely. That's so true. Thank you for that. Yes, it's so great to see you, Blue Butterfly. Thanks for hanging out always. Yeah, it's always a plus, especially if you're in an area where there are lots of native speakers too, whether it's Portuguese or Spanish, or even, like you're in an area where there's maybe like a heavy population, like a Koreatown type thing in certain big cities, right? Like if you have that ability, it's important to mention it. You might not think of it as being, well, like you're not bilingual Spanish, because that's like a really popular ask, but it oftentimes, especially if the provider themselves speaks that other language, it could be so supportive that you do as well, because they're going to attract patients that feel comfortable communicating with them in their native tongue. So totally mention it, even if you don't think that it's, inherently one that you've seen asked on applications and things like that. So. All right. So, hey, LaShanta. Hey, thanks for hanging out. Awesome. All right. So here we go. So let's go back to the calendar real quick, just to show you guys, see if I could show you guys something in here. So this system doesn't always like to behave for me, so we're going to test it out. Just going to pick something. Let's see. And yeah, didn't. Let's see, select all. Nope. I should have double checked. I wanted you guys to see the check-in side. Yeah, it doesn't. Yeah, it's all good. All right, it doesn't want to show me the appointment. You saw me just schedule it, right? It's not there anymore. So it's all good. I wanted you guys just to see there's a check-in area in the software that has the ability to quick view the patient's copay. And so what we were just talking about is, if I am responsible for my patient's intake and check-in, I'm typically going to be the one responsible for collecting things like their copays, and even sometimes payments towards deductibles and coinsurances. And so when that happens, you want to make sure that you have the ability to quick reference a patient's copay. And so in a software, you typically have the ability to add in a patient's copay and maybe any other sort of non-covered service notes that might be relevant, where you're going to have a patient paying out of pocket for said services. When that takes place, the person at the front desk is going to be responsible for reviewing or referencing those notes to collect an accurate amount. Okay. And so that's the whole purpose of getting a check-in system process that is a solid flow for you, so that you know how to review that data, right? So you want to make sure you're comfortable as a receptionist with, where am I supposed to look to know how much to collect, right? So that when you're collecting, you're collecting as accurately as possible. If they have a $25 copay, you're collecting it, and then you are putting that into the software as well as an amount that's been collected. And we talked about that with our list of responsibilities. So next is our batch eligibility. So I mentioned this previously. A lot of systems have the ability to check eligibility without you having to have manual intervention with every patient. Now, that doesn't mean that it's going to be 100%. In most cases, it's not. It means that what will happen is a patient, if their information is in your system correctly, meaning their insurance information and demographic information is inaccurately, we potentially could have the software automatically go out to the insurance carriers and check the eligibility check to see whether they are in fact in the insurance company's system with said ID, date of birth, and any of the criteria that you have gotten that is demographic related that goes into the insurance system. So sometimes it's name and address and the ID. Sometimes it's name, date of birth, and the ID, right? So every insurance is slightly different. Majority of them are going to, at minimum, look for name and date of birth and insurance ID number. And when that comes up, when we have our eligibility information, it gives us, in this system, it gives a green check. When eligibility is there, it comes back with a green check, or it has a big red X. And why we care about that is if we're getting information back that says they're not in the insurance record as being able to be billed, we call that eligibility, right? When they're not eligible for us to bill, we need to take pause and take a look more deeply at what's going on. It might be that maybe you entered something incorrectly. Maybe we inverted some of the numbers in our patient's date of birth or ID number, right? That's great data for us to get in there and get that fixed before claims start being created and need to go to insurance. And if for some reason we find out, nope, everything looks good, it's just not active anymore. The plan is no longer active. That then equips the receptionist with the conversation that needs to be had with the patient that says, hey, I noticed your insurance, is saying that you're no longer eligible. Was there another insurance on file? When that happens, patients might be like, oh yeah, I forgot to give you the new card, right? Oh, I think I gave you the old one or whatever, right? You might be nipping that right in the bud and getting it corrected. Or you might be converting your patient. Maybe they, instead of being insurance, now they are self-pay because their insurance no longer active. And so at that point is when you would convert them to a self-pay patient, right? So important to just know that you are, in fact, the one in charge of the front desk, that front end relationship. It's like the entry point by which a patient starts their relationship with the practice comes through you. And so getting the right information, asking the right questions, and making sure that all of that information and the answers to those questions that you've asked go into the right areas of your software. That's the heart of what happens in the revenue cycle, right? That in its essence is the reason why we care about this function of the medical office reception so much, right? Not only, yes, they're the face of the practice. Yes, they could impact the reputation. We've talked about that. But when it comes to the revenue cycle, the greatest value that they have to the practice is making sure that it's not garbage in, garbage out, right? We get things in the system that are accurate and clean as possible. And when we go to send our claims, everything runs smoothly and everybody's happy, right? Patients are happy because their claims are getting to insurance and they're getting paid. Practice administrators are happy because things are getting paid. And then you are happy because you're also hopefully getting paid as a result of everything running smoothly. All right. So those basic functions like that calendar responsibility, the registering our patients, the eligibility checking is often the main areas that are going to be heavily impacted on the back end of the practice if they're not done correctly. Okay. You're going to impact the providers and their schedule. You're going to impact whether or not we get paid, and the billers and the coders and all the other folks, right? If they're not eligible or there's no authorization on file or whatever, those are all things that impact our claims directly, okay? Next, we've got things in this area on this software. Actually, I'm going to skip down to the bottom here. So we have this section down here about reminders. I mentioned this very briefly. Such a wide range these days of what people are doing for reminders. I see practices that still have their patients, their front end calling their patients every day to confirm appointments. I also see a lot of leveraging of text message tools to be able to get patients to respond, which I think is the most intelligent way, because most people respond to text within 30 seconds of them coming through, and or see them, at least acknowledge those text messages before they might check a voicemail or even answer a call, So there are those types of things. There's also emails that go out sometimes. And so there's a wide range of communications happening, and not all front office receptionists or medical office receptionists are responsible for the reminding process. They might be the ones responsible for addressing if a patient sent a no back, meaning they're not available, or they don't confirm the appointment, or they need to reschedule their appointment. They've asked to be contacted to reschedule. That might be the responsibility of the receptionist to reach out to those patients when those types of updates come, right? Also, if you'll notice here, it's got people that are unconfirmed or undelivered, meaning like if the appointment reminder came back because it didn't make it to the patient, that is oftentimes something that is a responsibility of the medical office receptionist as well. Okay. So when a medical office receptionist has that responsibility for reminders, why it matters is they are the ones who are confirming a calendar for the next day. You might be in a practice that has a long wait list. If you have an open slot, you want that slot filled because you've got a wait list, right? So these are opportunities for the practice to not have providers sitting idle, and instead you have your roster, your calendar full, and your patients are able to be seen, especially those who are on the wait list and hoping to be seen when you have someone that falls off or is not able to make it in, all right? So that's our appointment reminders. And as I mentioned before, it could be your responsibility. Maybe it's not. Maybe there is a totally separate person that's responsible for scheduling in the practice, and you only schedule when a person is in front of you. That's very possible as well. Okay. All right. So, and same thing with registration. I'll kind of put that little caveat is there are practices that don't require front end. That is interfacing with our patients day to day. They don't require their front end to do phone registrations, meaning a patient that's coming into the practice in the future and they're calling in to make an appointment. There's a registration process that might happen over the phone. That might not be a responsibility of a medical office receptionist. It might be a scheduling team or a registration team that interfaces with those patients that have not yet made it into the practice. Okay. What questions are coming up? I want to answer more questions or comments. Like I said, if you guys have some that's definitely, some nods or some, that's a problem that I've had, or, recommendations for things for me to add to this list for the other receptionists or aspiring receptionists out there, please don't hesitate to put a comment in to let me know. So with that said, we talked briefly about cash controls or money management controls. When we have a medical office receptionist that is responsible for taking in payments, whether it's happening through credit card or through cash or check, if that's allowed in your practice, no matter what, likely that individual who's taking that money into the practice is also the one responsible for putting the payment information into the software, so that we have record of the payment being made in the office. All right. With that done correctly, we then are going to be reconciling, which means that we're going to be printing out a report that that tells us that the payment came in, and you're going to be able to check that report from your software against the actual money that you have on hand, whether it's through a batch credit card report or it's through counting the cash that you have at the end of your shift or at the end of the day. We care that the money on hand matches the money showing up in the report at the end of the day, on the report at the end of the day. That is what we call affectionately cash controls, or money controls, or I'm trying to think of other terms that I've heard. Revenue controls, right? Things that control that confirm and reconcile the money that has come in during a particular period. And it could be that your practice does this just once a day for the person who worked the whole day. Or maybe you have a longer day, so you have a morning shift and an evening shift. It should happen at the time that the individual who is responsible for the money that came in, it should happen at that point. And we can talk more about that on another day, because I have a lot of feelings about internal audits and cash controls and things like that. But just know that if you are responsible, you as a receptionist are responsible for the money that is coming into the practice. You want to protect yourself to make sure that you have done a cash control process, whatever it is in that practice, over yourself. Meaning, like, if you took in $500 in cash plus X amount in credit card plus whatever, and you are printing a report that reflects the amount of money that you are giving to your supervisor or manager, you are now protected. So if something comes up missing, it happens more than you would think. But if something comes up missing, it doesn't come back to you, because you have done your part to make sure that the cash is where it's supposed to be. And so you're following this process of cash control and making sure that you are CYA, right? Covering yourself, we'll say. So I like this comment from Nicole. We literally had a clipboard at our cash practice that signed and said, "What?" Yeah. So that's great. And you know what Nicole's talking about too, like, is kind of like we'll call it like a cash box, petty cash and cash box. Sometimes people call it petty cash, which is like an old school term. Basically, if a person needed to order food for an office meeting or something, oftentimes you'll have the docs that will say, like, "Oh, take that from petty cash to buy the food," or, get whatever, go get a birthday cake for someone at the office or whatever, right? So that sometimes is what you see the cash box used for. And that's all cash control. And it's so important, even in the sake that, like, you don't keep a lot of cash at the front desk on hand. It's still a matter of ensuring that if it came in and you were responsible for what happens to accounting for it in the software, you do that part. That thankfully isn't your responsibility. It's the supervisor's responsibility, but you want to make sure that you're protected, right? So, like, what came in that you took from someone, and when did you sign it into the box, using Nicole's point, did it get signed in? And did you show your supervisor or whatever the report if you had to have that done at the end of your shift? And beyond that, you are thankfully, whatever happens is their responsibility. And perhaps you're in a practice that the monies get deposited every day, or maybe not. Sometimes I've seen practices have really weird things, like they go once a week and they take a lot of cash in, and I'm like, what? You just have like hundreds of dollars just sitting around at your front desk? Like, and not even in a locked box or anything, just in the drawer. Okay. So yeah, I like this. So put the date and the time. Such. Yeah, it was very thorough. Yeah, exactly. Super helpful when things don't balance in the night. Yeah, and people don't think of the fact that even though we're not in a retail, specifically, there are still a lot of patients that walk around with cash and paying something like a $20 copay. They might have a $20 that they just want to give you instead of any other form of payment. And so it is helpful to make sure there is a process in place for those situations. So awesome. All right, so here we go. We've got a couple of last little things here that I want to touch on, and then we're going to wrap up, but I want to know what other questions y'all have. So when it comes to our checkout process, it depends on the practice whether you would be checking your patients out as well as checking them in. If you're the one who's checking them out, this appointment count and missing encounters might be your responsibility, which means, like, if a patient came in, they get checked in. When they leave, they get checked out, which means we believe they were seen. And then at some point, the provider themselves is also completing their documentation and creating whether it's the provider or nurse or front desk, creating an encounter, which is affectionately a visit, right? So it's saying, these are this is the reason for our patients coming in. These are the charges that were performed or procedures that were performed. And so there's maybe a list of charges. And that encounter is what is then creates our claim for billing. If we have a patient that was checked in and checked out, but there is no encounter created, or in some softwares, no medical note, sometimes it's just related to the EHR piece, there's no medical note on the back end, you might be the one responsible for trying to kind of identify that, right? It's like, wait a minute, I've got 3 patients that have a check in and check out, and there are payments that came in on behalf of that patient, but there's no encounter. You might be the one who goes to the provider or the nurse and says, hey, like, we're missing these encounters. Here's your missed encounters report or whatever at the end of the day. All right. So again, depending on the software, depending on the functionality of the EHR tools, it might be very manual that you're supporting, or it might be something that you are doing with this particular area with the practice management system. All right. There's also this element here that says recall query. So recalls are a general term for us reaching out to patients that maybe have gone MIA, right? So a lot of practices that have, let's use the example of a mental health practice again, right? Where we have patients that are coming in on a regular basis and they have a treatment plan that's been recommended and they fall off. And there's been a week has gone by or 2 weeks and they now haven't maintained or kept up with their treatment plan. Yes, some practices for providers might reach out to them, but in better process would be to not have a provider reaching out, but instead a receptionist that is reaching out in whatever way, right? Whether it's a phone call or a text message, and or maybe it's an automatic thing that happens with the software, but there is a recall process that says, hey, Miss Doe, we've missed you for these last few weeks or few days or whatever. The providers asked me to reach out to you, right? So like that's the recall process, and it just helps to stay connected to your patients. You're there hopefully as a support for them in whatever they're facing in this moment. And so we'll call it levels of accountability, right? You now can support them by holding them accountable for maintaining what's responsible to them. So yeah, I love this. Yeah, it's very similar. It really is. It's very, very similar. So yeah, that's why when you talk about it, I'm like, yeah, it's pretty much the same thing. It's just, 4 legs, 2 legs. It's a little different. Awesome. All right. So the recall process, again, may be a responsibility of yours, maybe something that you just hit a button because the software that does it. But it is something that supports the practice retention, meaning the patients staying consistent and staying patients, right? So it helps the retention rates for your patients. And it also is what we would consider an internal marketing effort, right? It's like we already have these relationships with these patients. They already know who we are, and we have a relationship established in a way of care. So we want them to come back instead of trying to attract new patients, right? It's like, how can we serve and improve upon what we do for our current patients rather than trying to get out patients, right? So, okay. So down here, I've got this setup stuff, all these like setup rules and things like that. Probably not your responsibility primarily, but you might need to be the one there to support what happens there, which means like you might be, as I mentioned before, the one who has to help a doc block out their calendar. Let's say doc says, you know what, we're done with Fridays. We're closing the office. We're just Monday through Thursday practice. You might be the one who has to make that change in the system. And so having awareness of where to do that is helpful. So cool. All right, my friends, I'm going to stop sharing and I'm going to talk a couple of last little things, and I want to know what else you guys have in your minds. So we talked about cash controls. We talked about routing our patients. We didn't talk about charges and charge entry. And the reason for that is that there are a lot of practices that utilize EHR or some sort of electronic way of a procedure code getting onto a patient's account to account for the day, right? So there's a chance that you're not going to touch any of that. What you might have to do is ensure that there is a procedure code present, like we talked about, to cover the missing encounters, or you might be the one responsible for double backing and making sure double checking and backing. I don't know what I'm trying to say there. Double backing. Checking back on a patient's encounter to ensure that they have things like diagnoses present, or what we talked about already, a referral and things like that. So you may not be responsible for putting it in, but you might be a second set of eyes to just give the thumbs up that it's complete at the end of your shift. Okay. There are some practices that do put on the front end the responsibility not just of cash control reports, but also end of day reports. So closing out the day by making sure that all charges are input and accurate. Maybe you're there as a double check for whether or not a patient who has a self-pay service that, whether or supply that was purchased in the office, maybe you're the one responsible for making sure those are accounted for on the end of day reports, right? So that again is going to vary from practice to practice. It could be something that's the responsibility of your supervisor, or it could be yours. Okay. So I like it. Blue Butterfly says, focus is important when multitasking, especially for patients. Yes, same name, same. Yes, absolutely. Oh my goodness, yes. This is the deal. I love to think of reception work as a really great place for people that have the superpower of ADHD, like me. I love the area of front desk because there's never a dull moment. We're kind of like this. You're like, all these different things happening at once. However, yes, what is possible is if there's not enough downtime in a practice, and I've had some practices that are like, oh, we don't need downtime. Well, I'm like, everybody needs downtime. Like, we all do. You need an hour at least, maybe more, depending, but in between a shift, before and after, because there's just so much happening at once. It's like, like you open the doors and it's like, like things start just coming at you, like phones start ringing, the patients are in front of you, and then the providers are coming up, and it's like there's all this stuff happening at once that you need those moments to pull back and kind of like regroup and just decide, what needs to be done? Did I miss a step? Is there anything that needs to be tended to in this moment? So yes, focus is at the top of that list. And also giving yourself time to have those little focus blocks throughout the day that can give you the reset to just, be like, okay, what I just did, I did it right for the last 3 hours. So cool. All right. Yeah, such good points. So I love it. Yes, so important. Details details matter. Details matter. They are matter. All right. So this was really great. I hope that this helps. And my friends who are breaking into healthcare for the first time, I just know that you're not alone. When we all started in healthcare, we were all like, that and that and that and that and that's responsible. That's my, we all have this. The truth is that you just, you wrap your head around one piece at a time, and we're here to help you. And in Inlera, we have training actually, and if you hadn't been introduced to this, the Medical Office Reception Excellence course is dropping here shortly, as well as the language of, we call that course Medical Office Reception. We affectionately call it MORE, and then we have what we call the language of MORE, which is language of Medical Office Reception, because there's language there, and there's things that you may not need to know that take place in the back office, right? But there are things that you would want to be familiar with, especially like we've mentioned some of this during our trivia, right? Different types of shorthand or acronyms that are utilized in a practice that you would never use anywhere else. In healthcare, we have our own language. And so there's a need for you to gain some skills even before you get out into the environment and are looking for a position. And if you're someone who isn't necessarily directly looking for a role as a medical office reception, you're doing things like overseeing a team or trying to get clarity on what happens on the front end, it can still very much support you, because I want you to know how you can best support the patient experience. And the way to do that is by having folks that are trained properly in these roles. So yeah, so that is Medical Office Reception Excellence. And Nicole just put the bundle in there. There is a bundle for both. It includes more and a language of more, lang of more, as we call it. So we've got our own shorthand over here in these parts. So yeah, so let us know what questions you have if you find yourself building some questions here over the next few days. My folks who are channel members know that we have a channel member live coming up here on next Thursday. So make sure that you RSVP for that. And that's just like hit the little bell to be reminded basically in YouTube. Also, if you haven't checked out our website, we now have an events page. And oh, Nicole just shared it. I love this. See, we're in sync. We now have an events page. And on our events page, you can keep up with all of the things that are going on the channel, which is so cool. We have the ability to remind you about things that are happening that aren't necessarily on YouTube, but we want you all here or on Facebook, whatever, that we want you all to be aware of because they can be valuable for you. For example, our Medical Billers meetup is coming up next month, I think, in August. So, you go to the calendar, that link that Nicole just put in there, inlera.com/events. And with that, stay connected to everything that's happening in Inlera, all around the different spaces and places that we hang out. And then I just want to also mention that on that same space, you're going to be the first to know about things that are launching. Like we have something coming up in August that I will that you'll hear about here shortly. My friends who are in the Facebook group know what I'm talking about. If you're not in the Facebook group, you'll want to join. But we have, I'll do a little. Should I say something? I'll just say it anyway. I'll say it anyway. We actually have the official Medical Billers Network being born. So those of you who are may not know that our long game vision with the Medical Billers Network is actually to create a full-on community specifically to support people who are medical billers, to help them find people, whether to work for as contracts or be employees for certain organizations. So having individuals supported, and then also helping our medical billing companies getting matched with the right fit for both practices and providers that are looking for medical billing company solutions. So super excited. It's our very first iteration. It's starting out with a list. If you're in the Facebook group, then you have the ability to get onto that already. It's a Google form that is pinned, I think, or featured at the top of the page. There's also a video that I put up there the other day that has the link there as well. But yeah, we'll keep reminding you guys. We are going to launch the first iteration of it, August 1st. It's going to evolve. We have a lot of vision around what is going to take place with our Medical Billers Network. Super excited about it, but we want to make sure that you guys get on there because there's been we get emails all the time from people looking for billing companies and medical billers in certain areas and certain specialties. And so we really want to be able to just get you guys to these individuals that are looking for support. So cool. All right. And we'll probably do the same thing for Medical Office Reception. We should maybe look at that as well. But for right now, we're Medical Billers Network for that list. And our Medical Billers Network people who are in that Facebook group get that first access to that particular that list. So cool. What else? Am I missing anything else? I'm looking at your reminders in here. Oh, yeah, it's pinned. There we go. So there it is. It's pinned at the top of the page. So cool. All right. I don't see any other questions coming in yet. Just checking. So big shout out to our channel members. They're scrolling down at the bottom of the page. We love and appreciate you guys. And I look forward to talking to you guys. My friends who are channel members, you might recall during our last channel live, we had Nicole give herself a challenge. So you get your update on the challenge from Nicole, and just thrilled to be able to share that with you. And so if you're not a channel member yet and you want to be a part of it, you get access to all of our previous channel lives that have taken place, as well as being able to get onto future as downloadables and all the other things that we are going to be rolling out to channel members only. You will have access to all of that legacy as well. So cool. Well, thank you guys so much for being here. I appreciate you for your time, for your energy, and I will see you in the next video. Take care, guys.